Patient relationships, not records. It's one of the mantras for Salesforce, and that's why I'm here with Dr. Joshua Newman, who is the Chief Medical Officer for Salesforce. Dr. Newman, thank you so much for coming by.
Thanks for having me.
Let's talk a little bit about why Salesforce has gone so big this year at HIMSS.
Well, HIMSS, as you know, is the largest convention for health IT professionals. About 40,000 people come here. A year ago, we released our Health Cloud, which is an industry-specific application that Salesforce released for taking care of patients. We released it a year ago, and we're here a year later showing how much we've grown and how much more we've added to the product.
Let's talk about that. Give some ideas of some of the things that have changed to make it newer, better, and more improved.
Well, we're a cloud-based platform, and so Health Cloud inherits all of that benefit. So it gets better every 4 months in the same way that a lot of the applications that we enjoy using all the time do, but unlike a lot of health enterprise software. So we're really excited this year. At this moment, we've already had 4 releases. Right now we're announcing 3 specific features. The first is risk stratification, the second is lead to patient conversion, and the third is segmentation. Of those, my favorite is the risk stratification because it allows us to use risk stratification as a variable for all the different engagement stuff that we do as CRM. The other big category of things that we're announcing this year are our partnerships. We've got about 15 companies that have connected their technology to Health Cloud, augmenting the functionality for things that we don't do. Things like scheduling, certain kinds of analytics, care plans and protocols, patient education. And with those kinds of things put together, you can solve a lot of different problems, way more than you could do with just Health Cloud alone, and way more than even a lot of other vendors can do by themselves. So we take that as a point of pride, that we have a culture that's open, that brings other folks in, so we can solve problems for customers together.
We can sense your excitement about it. Give us some idea, is that a part of why Salesforce is in healthcare?
Well, we've been in healthcare from the very beginning, and a lot of folks don't know this, but for 18 years of our company's history, we've been selling into healthcare. And recently we found that there's a tremendous interest in taking care of patients the way that other industries take care of their customers. Close contact, delighting those folks, solving their problems, easing their anxieties. When you think about the application of those kinds of things in healthcare, and even more importantly, the benefits, not only the business benefits where you see in every other industry, but the health benefits of giving someone really good service in the way that they really want it. The problem is tailor-made for Salesforce. So we're really excited about what we're doing in healthcare, and we're thrilled to be able to bring some of the technologies that we've proven out in so many other industries to healthcare that's been clamoring for it.
Many things exciting happening for Salesforce this week. What's the most exciting thing you've seen?
You know, the thing that I think is most interesting to me is the energy and the visibility and the motivation that people have to think about CRM. For a long time, when I trained as a family doc, people didn't really think about CRM. People didn't think about what happened before you got to the doctor's office or what happened after you left the doctor's office. And because there's so much more interest in that, whether it's because of value-based care or the competition that's hitting the healthcare market, or really just a sensitivity to the experience of the patient. No matter what the real motivation is, people are pointing to CRM. And so I've been thrilled to see how much energy and excitement and interest there is in what we're doing. Nothing could make a chief medical officer happier.
Dr. Joshua Newman, thank you so much for joining us.
Thank you very much.